now moving towards a very important topic of the furcations, which will basically the classification of the indexes, that how we actually classify the furcations. We use indexes for this and different types of classification. So let's start it. Bismillahirrahmanirrahim. So they are saying that extent and configuration of these furcation defects are factors that help in diagnosis and treatment planning, because if you know that which class or which type of furcation, so according to that you will diagnose and you will treat the patient actually. So the horizontal and as well as the vertical, so they are saying that horizontal and vertical both attachment loss are combined for the measurement of the furcation is involved. Here we use classification which is Glickman classification. So in grade 1, what Glickman classification says that this is the early stage of furcation involvement. Yes, the pocket is supra-bony. Now actually when you consider the pocket is supra-bony, so what is supra-bony pocket? So basically this is the supra-bony pocket when the junctional epithelium stays in position and it is coronal, but when the junctional epithelium moves apically, so it is called infra-bony periodontal pocket. You can see here. And in supra-bony pocket the bone loss is horizontal, but in infra-bony pocket the bone loss is actually vertical. Okay, it's vertical bone loss. Okay, infra-bony the vertical bone loss occurs. Okay, now basically it affects the soft tissues. In early bone loss it can occur with an increased probing depth, but radiograph changes are not usually found. Means if you do the radiograph of this patient, there will be no significant changes in the okay. Then moving toward grade 2. Grade 2, what happens? It can affect one or more of the furcations of the same tooth. It is cul-de-sac. Cul-de-sac means then you insert a probe on from one side of the furcation, but it does not come out on another side. It has a definite periodontal horizontal component. If multiple defects are present, means if it has multiple defects and not communicate with each other, again not communicate with each other, because a portion of alveolar bone remains attached to the other side of the tooth. So the extent of horizontal probing or furcation actually determines that the defect either it is early stage defect or advanced. Vertical bone loss actually presents or represents the therapeutic complications. Okay, it actually basically complicate the procedure. Radiographs may or may not depict again the furcation involvement maxillary molars, because radiograph overlap of the roots, due to also overlap of roots. However, so they are saying in next page I will show you a diagram in which there will be a presence of furcation arrows that indicates the possible furcation involvement. Now into what happened, the bone is not attached to the dome of the furcation. Now bone is not present and the opening may be filled soft tissues or may not be visible. The clinician not may be able to pass. So means in this happened, what happened, that the periodontal probe is not even be able to pass but completely through a furcation because of interference with the bifurcational ridges or facial-lingual bony margin. So they are saying when the clinician cannot pass the probe to the furcation, because when there are bifurcational ridges or either they have facial-lingual bony margins. Okay, but the clinician can do one thing, that it can add the buccal and lingual probing dimensions and obtain a cumulative probing measurement that is actually greater or equal or greater than the buccolingual dimension of the tooth at the furcation orifice. Okay, so this is grade 1. Sorry, grade 3 actually. Properly exposed angular radiograph of class 3 furcation display the defect as radiolucent area in the crotch of the tooth. So in first two there was no radiographic findings, but in third you will see the radiographic findings. In grade 4 what happens, the interdental bone is destroyed. Yes, and the soft tissues have been reside apically, so the furcation opening is now visible. Tunnel, therefore, it exists between the roots of the affected tooth, and periodontal probe can easily pass from the aspect of the tooth on another side. Okay. Despite the valuable information found in clinic examination, radiographs are essential for complete. Yes, they are important for the diagnosis of the treatment. Now, you will see number A, which is actually grade 1. Although you cannot see the visible, you can see actually a space that is visible at the entrance. You can see here, this is the entrance, little space. To furcation, no horizontal bone component is evident on probing. Okay, means there is no horizontal bone loss can be found on probing. Okay,